Christine Schneider, the Visceral Voice.
Welcome to the Visceral Voice Podcast. I'm your host, Christine Schneider.
And I'm your co-host, Kimberly Doreen Burns.
Through this podcast, we aim to bring you the most current, up-to-date research on voice science, function, pain science, movement, and everything in between.
We also aim to bring you information and perspective from all angles of the theater industry.
I am on a quest to learn everything I can about the living, breathing body and its intricate connection to the voice. This podcast documents the continuation of my learning and my experience as a professional singer, a nutritional consultant, a movement practitioner, and a manual therapist.
And my learning as a professional performer, voice, acting, and musical theater educator.
Join us as we strive to provide current, knowledgeable, creative, and compassionate information
to help you restore, regain, and create happiness and success on your vocal journey.
Hey everyone, welcome back to the podcast. In today's episode, Kimberly and I have a conversation with Jenna Battipaglia. Jenna takes us through the huge, amazing, very vast profession of speech language pathologists, the many different specialties or specialities or categories and subcategories that one could actually get trained in as a speech language pathologist, and why it could be important as a professional voice user to find a speech language pathologist that specializes with the voice and with professional voice users, and if you are a singer with the singing voice. A little bit about Jenna. Jenna is a clinical assistant professor in the Department of Communicative Sciences and Disorders. She is a dual alumna of New York University's Steinhardt School of Culture, Education, and Human Development. Jenna earned a Master's of Science from the Department of Communicative Science and Disorders and a Bachelor of Music and Vocal Performance from the Department of Music and Performing Arts Professions. She is an ASHA certified and New York State licensed speech language pathologist and holds a Teacher of Students with Speech and Language Disabilities certificate. Clinical and teaching areas of interest include voice disorders, professional voice use and the singing voice, and gender-affirming voice. Jenna's teaching includes courses in the clinical practicum sequence, voice disorders, and she provides clinical supervision to graduate students in the NYU Speech Language Hearing Clinic. Jenna is certified and trained in LSVT, video stroboscopy, and is a member of ASHA, the Voice Foundation, VASTA, PAVA, WPATH, and the New York Voice Study Group. I met Jenna just this year, actually, even though we have heard about each other for probably a number of years. So it was really cool sitting down and actually having this conversation today. So here you are, Kimberly, in my conversation with speech language pathologist Jenna Battipaglia. Hi, Jenna. Welcome to the podcast.
Hello. Thank you so much for having me.
Before we kind of dive into all of the different things about speech language pathologists and their specialities, would you mind just kind of taking us down the road of your journey into becoming a speech language pathologist?
I will do this as succinctly as I can, but it's been a journey. It's a great word for it. So I grew up singing, performing, and I majored in vocal performance in college, concentrating in musical theater. And I was in the jazz choir. I love singing jazz. And my junior year of college, I experienced a vocal injury in the form of a left vocal fold cyst. And it's really where my journey began. So I always thought about the voice, was so interested in the voice and different voices and hearing them and trying to mimic them and so many singers and voices I loved, but it wasn't until this moment that I really became interested in the physiology and the science behind the voice. At that time, I was having bi-weekly scopes of my vocal folds to track progress. I was going to voice therapy with a speech language pathologist specializing in the voice. And then I also wound up having vocal fold surgery, having a rehabilitation process. And then there I was in my senior year of college. And I really thought to myself, well, this is very interesting. And I didn't see this coming. So I applied to graduate school to become a speech language pathologist. And since then, my work experience has been a bit varied. I've worked in the Department of Education as a school-based speech language pathologist. And I also have done a lot of private work in vocal coaching and therapy. I was an adjunct for several years, but now I'm a full-time clinical assistant professor at the Department of Communicative Sciences and Disorders at New York University. And I also work part-time as a clinical specialist in voice, SLP, at NYU Langone Rusk Rehabilitation. So in many ways, I still feel like my journey has just begun. But in looking back, I'm grateful for everything that has led me here. But it's been a ride.
I think a lot of people can kind of be curious about a speech language pathologist and their job because there are so many different specialities. So can you kind of take us down a little journey informing us of what are all the different modalities or specialties that a speech language pathologist can actually dive into?
As I said in my journey, I worked with a voice therapist who was a speech language pathologist specializing in voice. And once I knew that, I applied to a speech language pathology graduate program. However, I didn't really even understand everything a speech pathologist does. I mean, it really is a very, very, very vast array of specialties, subspecialties, and areas in which we work. So to first kind of give you a brief overview, I'm going to quote from the American Speech Language Hearing Association, which is speech language pathologists and audiologists. It's our national governing body. And so their definition of what SLP is that we work to prevent, assess, diagnose, and treat speech, language, social communication, cognitive communication, and swallowing disorders in children and adults. So it's a really big umbrella for all of these things. When I say I'm a speech pathologist, people will say, oh, do you work with children or with adults? And it's really so much more complex than that. A lot of subspecialties or specialties, they do lend themselves to a certain, area of population, but it's really, we work with everyone across the lifespan. So speech pathologists can work with, children as young as 12 months or younger and up until 80 plus years of age. So it really is a very, very, very big area of study and of work. In terms of communication, the basic breakdown of what communication even is the ability to interpret and express, thoughts, feelings, ideas, express yourself, but also receive that information. And so the main two categories of communication are speech and language, and it's in the name, right? So I'm going to break those down further, and then I think you're going to see how deep this what's a good metaphor? This river really runs. So in the purview of language, we have receptive and expressive language. So receiving, comprehending, processing language, and then expressing that. And within those areas of language, there could be a disorder. There could be just a delay. You could have a developmental disorder or delay, something that you were born with, or an acquired developmental disorder or delay. And we see that in diagnoses such as aphasia, which commonly happens in, adults after experiencing a stroke or a CVA. We also see acquired language disorder delays in people who have experienced traumatic brain injuries. And then, on the developmental side, we can see a range of cognitive impairments or associated, genetic diagnosis or neurologic diagnoses like autism spectrum disorder, Down syndrome, etc. So the field of language in itself is really, really robust. And then, then you have literacy within that. And literacy, we can work with decoding, phonological awareness. And then sometimes you see impairments in language due to cognitive skill deficit. So then we have a whole range of cognitive linguistic impairments. So even if you're a speech language pathologist that works with language, there are many, many subspecialties just in that area. Then we come on to the speech side. And in speech, just at face value, there's speech sound disorders, right? So there's articulation disorders or delays, which is more motor based. There's phonological disorders. So that's the presence of phonological processes, which is linguistic based patterns that are consistent in production of speech. And then we have motor speech disorders, either acquired or developmental, and those can include apraxia of speech or dysarthria. Within speech, there are two more categories, and those are fluency, which includes stuttering, cluttering, and other fluency disorders. And then we get to voice, which of course we'll get more in depth into when we speak more about being a speech language pathologist who specializes in the voice. Speech language pathologists also work and diagnose and treat feeding and swallowing disorders. And most commonly, I think people might know the term dysphagia. Some people say dysphagia. It's a tomato situation. But we also, do feeding and swallowing. So it is a very, very big field. And, it's one of those things where if you're in graduate school, you might go in thinking you want to work with just this one population and this one type of area of communication. But then with every class or course you take, it's just like doors keep opening and you're like, no, I really want to work with that population or this disorder. So it's a very exciting field. And even within, I just kind of touch the surface. It goes so much deeper and there's constant new research coming out. It's just, it's a very exciting field. It's never boring. We never get complacent. We're constantly, doing continuing education. So I've really enjoyed just being a speech language pathologist for the past decade.
Jenna, it's so wonderful to hear you talk about all of the different aspects of being an SLP. And I just have to give a personal shout out as a recovering vocalist, as someone who also I had bilateral pseudocysts and I had vocal surgery about 4 years ago. And I saw an SLP to sort of help me through vocal therapy to get me back on the right track. And that made me very passionate to then become a voice teacher and teach young singers how to use their voice properly. So it sort of sounds like a similar path that we went through something that was sort of traumatic to help us find where we're at. But yeah, I found it fascinating what the SLP that I saw, what they were able to teach me about the voice. So your work, yes, while you say it's very exciting, it is very helpful and applicable to our theater industry.
Oh, absolutely. Yes. Many facets of it, actually, aside from the voice as well, in speech production and many different areas.
Now, in New York City, there are many speech therapists who are speech language pathologists or at least several, who do specialize with the voice and with professional voice users and with the professional singing voice. So what are ways throughout the rest of the country, maybe in other parts of the world, how would someone go about finding someone that specializes with the professional singing voice?
My best advice would be to find your nearest voice center. Just as you'd want to find an SLP that specializes in voice, you also want to find an ENT or ear, nose, and throat doctor or otorhinolaryngologist who specializes in the voice, and we often call them laryngologists. So find the nearest laryngologist, a voice center clinic, or, outpatient or attached to a hospital, affiliated with a hospital, sorry. And they will very most likely be able to guide you to a voice therapist, an SLP that specializes in the voice. They most likely work very, very closely with someone like that in their practice or in their referrals. So that's really where I would start to look for someone like that if you're in need.
And so walk us through, if someone comes to you, they know that they've wanted a speech language pathologist who specializes with the voice. You are that. They come in to work with you. What does that look like? What does it look like for a speech language pathologist who specializes with the professional voice?
So I'm able to perceptually diagnose or comment on the behavioral symptoms that's presented to me, so I can tell if someone has dysphonia and to what severity or what other characteristics their vocal quality is presenting with, or perhaps breakdowns between the coordination of their subsystems of voice, right? And that includes respiration, phonation, resonation, and even articulation. I am not able to diagnose a voice disorder or any issue with the voice. That is what the ENT does. So typically when someone comes to me with a voice injury or a voice disorder, they have already seen an ENT, had a stroboscopy performed, an evaluation done, and then they come in and I know, for example, which lesion that I'm working with, but at the end of the day, I'm working with the perceptual symptoms, and often the lesion really guides me mostly in the prognosis. If I think this is a type of lesion that responds well to voice therapy, or if learning these behavioral modifications in the voice use will be a great first step if the lesion doesn't respond to it and then ultimately their surgery. Well, if they come to me pre and post their surgery, we already have that foundation to work from in the rehabilitative process as well. So it's extremely patient-centered. So I'll ask the patient, tell me in your own words, what's been going on with your voice? What does it feel like? Because even if I read a report and I have, the laryngeal imaging, and I know how the vocal folds are functioning, every person really experiences that differently. And it manifests in different ways in their lives. So, an interesting thing that I heard once, and it really rings true, is that a voice disorder is only a disorder if one perceives it as such. So you might hear people in your lives who are not voice users or, teachers or even that aware of their voices who present with, audible dysphonia, who are like, no, whatever. That's just my voice. I feel fine about it. It's when it becomes a barrier to you in your life, you want the change, that it really truly is a voice disorder, whether or not there's a lesion present. I guess, I always ask the patient or the client, tell me what's going on in your own words. What are your goals for your voice? What do you ultimately want to be able to do? And that also informs the carryover that I work on in my sessions with them. Is the goal to keep up with family and friends on the phone? And that's becoming really, really difficult, right? You're a voiceover artist and you have an audition next week, or you want to keep doing this forever, or, it's a very, very big range of goals. I don't just see professional voice users. So it really gives me insight into what a person's voice means to them, what they most use it for, and what they most need it for, and how they're connected with it. So I always start there. And then we ease into exercises, carryover, exploration. We always have a home program. If you are familiar with the motor learning theory, you know that no real behavioral change in motor coordination can be made once a week from a voice therapy session. It's something that you have to immediately start integrating into your life. The other 6 days and 23.5 hours, you're not in a session.
I say that to my clients all the time. I'm like, I'm only with you for 50 minutes a week. So you have to take these practices into your daily life. Yeah.
Right. If someone wants to see change, they really have to internalize that. And compliance and self-efficacy is like 50% of how we're going to start to see progress. So having that conversation, that education, that counseling, not only on how the voice works, how to take care of it, what are some practices you can incorporate into your life to better care for your voice, but also, okay, tell me 2 times a day that you're going to practice. We can talk about habit bundling. What's something you already do every day that we can add on to make this an accessible, easy part of your life? So yeah, I completely agree. Mm-hmm.
Hey everyone, I wanted to take a moment to tell you about our upcoming conference, One Body, One Voice. The Visceral Voice is teaming up with Penn State Musical Theater Voice Pedagogy. It'll be August 6th through 8th, and the faculty includes Raymond Sage, Gwendolyn Walker, Jared Trudeau, and me, as well as guest teachers Dr. Felix Graham, Brittany Chinell Johnson, Carlita Victoria, and Katie Travis for a complete content-packed weekend promoting vocal health and holistic growth. We are going to have such an awesome time talking about musical theater pedagogy and the body. If you are interested in joining us for One Body, One Voice, August 6th through 8th, please feel free to register on the website at www.thevisceralvoice.com. We hope to see you there. Now, back to the show. Yeah, I really love that one of the very first things that you mentioned, Jenna, was basically the behavioral science and recognizing that when someone comes into your clinic or your studio, you are able to recognize that there is a human being in front of you and that emotions very much affect the voice, and something that we really try to do, I try to do as a movement specialist and a manual therapist, is always recognize the behavioral science aspect, that there is this human being. How is this affecting them? What are they perceiving that is happening, or how is that affecting their everyday life? And then recognizing that the way that we then speak in return is, and you and I have talked about this before, is encouraging and recognizing the significance of someone, their significance, and the significance of their voice is very, very, very powerful. And so I love that the very first thing you brought up is including that behavioral science.
Oh my gosh. Sometimes it's everything. And in this current state of pandemic life, seeing a lot of, people come in that have been impacted by whatever their quote unquote new normal has become. And that's not only the format in which they're speaking or working, but it's also the level of stress, anxiety, and all of that. And sometimes, people very much segment that separately from their voice, and kind of bringing that together holistically and acknowledging and having that conversation of, no, your voice is very much you. So if you are experiencing and feeling these things, it's going to show up or manifest itself in the voice. Now, of course, that happens much more to some than others. It's definitely something to explore and to talk about with your patients, clients, students.
Absolutely. It's such an emotional experience. I mean, if our listeners can just think about that, the ones that aren't professional voice users, if you don't feel confident speaking or the sound of your voice, it's going to affect you emotionally because you're going to be harboring all of your truth inside of you.
Not that you cannot have empathy for that if you have not experienced a vocal injury. However, if and when, or knock on wood, you don't, but if and when you have or do, it brings that empathy to a whole other level, especially if you are someone who's used to having a consistent voice, a voice that can use, not really worry about, be conscious of in the way you use it. But, if you are someone who is really hyper aware of your voice and you have experienced what it's like to lose it, not have it, not be able to use it, not access it, even if it's, to someone else's ears so mild, oh my gosh, the impact is so profound. There was a book that I read when I was little that I love. And I talk about it a lot with my students when we speak about empathy and counseling in any area of communication that we're working with. It's called Walk Two Moons. Have either of you read it? It's a chapter book. I probably read it in elementary school. The premise of it is like, you don't know someone or you can't understand someone until you've walked 2 moons in their moccasins. It's a beautiful book. But, I think we can extend empathy into putting ourselves in someone else's shoes. But if you have lived that, it really deepens your empathy for that. I know that it has mine. It's also given me a built-in form of negative practice, for better or worse. I know what productions feel like, where they're coming from, how they're being made when you don't have access to certain parts of your voice or subsystems aren't coordinated properly. It is, in a way, a gift to have experienced that, especially if you work with the voice. In some ways, I wouldn't wish it on anyone. We don't want that to happen. But, as speech pathologist or a voice therapist, and of course, also as voice technicians, we work with our singers and our voice users in building up that coordination and carrying it over until it is so generalized that it happens automatically. That new motor trace and pattern is so built in now. It's your new go-to, your body's new go-to. And so that you don't have to think about your voice every time you use it. But I would be, remiss if I didn't say there is not a second that I do not think about my voice and how I'm using it and when I'm about to use it and what other people will think of me using it, because I've had such a ride with my own voice. And, for many, many years, I completely shut that door on myself and my own voice and exploring it and acknowledging it because it cut too deep. And I put 1,000% of my focus on everybody else, my students, my patients, my clients, everybody else's voice. I was all in with and I cared so much about, and I kind of put mine to the side. So I'm kind of on, part 2 of my voice journey currently. It's a whole new joy and it informs my work always.
Can we talk a little bit more about the rehabilitation process that you do, specifically voice therapy? Okay, we hear this term a lot, and I'd love to give sort of a definition or even an example of some voice therapy techniques for our listeners.
It really, it depends on the patient you have in front of you, right? Everyone's a little bit different, but your ultimate goal is to coordinate all of the subsystems. So again, respiration, phonation, resonation primarily, and then have them carry over into speech and or singing. There's a lot of, as I said, education, counseling, interviewing, and information you want to get from your client or your patient. But then really, this is when there's parallels between what you do as a voice teacher and what we do. So how would you start off, for example, with a singer in front of you for the first time? What's like the first type of vocalese you would do with them?
Probably lots of slides, and then I'd explore their different ranges and see where they're comfortable singing.
Mm-hmm. So as I said, an ENT performs the stroboscopy and does the official medical diagnosis, but then often the SLP is part of the evaluation process, and we do both objective and subjective evaluations. So the objective evaluation part is the aerodynamic and acoustic analysis. So we'll hook you up to a microphone and we'll use a program like CSL Visceral or Prot, or there's many, many different softwares. And we will literally measure the voice for acoustic properties and aerodynamic properties. Then we will also do a subjective or perceptual assessment of the voice, where we will note vocal quality and characteristics the voice is presenting with. And then lastly, like what you just said, we will do stimulability trials or trial therapy. So we will explore, so what happens if we do a lip trill? How does the voice respond? What happens if we add in some resonant hummings? In the objective measurements, we assess pitch range. It's called maximal phonational frequency time. So that's, or MPFR. And that's how we'll kind of assess the parameters or the bounds of how high or how low someone can bring their voice, so their range. And then that also informs our trial therapy and our work in the sessions. However, we're primarily working with the speaking voice. So do we need to know that someone can access, B5 easily on a Raspberry? Sure, that's helpful. That's good. It shows awesome flexibility, right? But we want all of that generalized into speaking. So once we have that, okay, good, this person responds really, really well to these therapy trials. Now I have somewhere to start with them. So we kind of go with the patient's strengths in the first session. So I know that Christine responds really, really well to resonant hums and maybe some chanting. And we can do some carryover at the paragraph level and then into some spontaneous conversation. So I would mostly start with good old SOVTs, semi-occluded vocal tract exercises. So we'll do some lip trills. There we go. You got your straw. We'll do some straw phonation. I like using cup bubbles a lot, especially with people who have not really worked with their own voices in the past. So non-professional voice users, let's say, because cup bubbles provide a lot of kinesthetic feedback into the breath, the phonation, the sensation of ease at the level of the throat. A lot of people who don't have any previous voice experience, when you ask, well, where does your voice come from? They'll point right to their neck. And so you kind of have to retrain and shift their perspective well, actually voice comes from here in the abdominals and the diaphragm. And, so there is a lot of simultaneous education. You may have to do some abdominal breathing, training. Move the breath lower if you notice any clavicular or higher breathing happening. We also might start with some tension release, right? So important. I always say to my students who I'm, teaching or training in voice therapy, you always want to make sure that the anatomy is released and aligned so that we give the physiology even a chance to do what it wants to do, right? And what it can do. So we'll always, assess and start there. But in terms of actual voicing, always begin with an SOVT, whichever one the patient responds mostly to. It's funny, some people can do a Raspberry no problem, but have, lip trills, you take for granted, right? How many people can do or not in lip trills. So cup bubbles is a tried and true favorite. Then we'll start, moving that toward some humming. If the voice is a bit breathier, we'll want to bring more resonance in. Conversely, if the voice is a bit pressed, or, if they're not using their breath with their voice, we're going to want to do some flow phonation aspects. So we can even do stretch and flow, get a tissue out, get the breath moving. And really, it's all about increasing this person's awareness of the sensations they are feeling in their body when the voice is feeling easy or when it's not. When it feels like it's coming from their throat, like, or when it feels like, it is smooth and easy. And then you want to keep, every few trials, keep bringing that up. Good. That felt a lot better. Where did you feel at that time? So, in motor learning theory, you want to close the loop of feedback. So you give the patient feedback, you encourage them to think about and give themselves feedback to their body. And you always want to lean more into the sensations and the feelings, then that sounded great. Because if we rely on sound, oh gosh, we're going to get into our head. We're going to try to produce that same good sound, even if we're using a counterproductive compensation to make that sound. So you always want to go by, okay, what did it feel like to produce that easy phonation and carry it through to, the sentence level or paragraph reading or speech? How can I maintain that feeling? And so you scaffold over time and increase the complexity of really the linguistic context of the tasks so that it slowly builds up and generalizes. And that first, the patient develops what we call recall schema. It's what I like to refer to as a light bulb moment. So that's when they say, oh, I felt that. That was right. That was so easy. I know exactly where that was. Oh my gosh, that's what we've been working toward. That's the light bulb moment, recall schema. But you want to work toward recognition schema, which is when they make a production like, wait, I know that wasn't, hold on, let me try that again. And then they make adjustments within themselves and then boom, they're back. So it's kind of like keeping the car in the lane, right? Instead of swerving in the road. This coming from someone who's lived in Manhattan for 15 years, and who knows how long it's been since I've driven, but I would imagine you want to keep the car in the lane. So that's recognition schema. And then eventually that, transitions into beautiful generalization and confidence. And because they've been practicing through the week, they know that they have the tools to keep this up or, to use whatever tools you've given them to access if they're having, not as great of a voice day, or if they have a super high vocal load at that day. So, you're giving them the tools to do this themselves. You're really just providing education, awareness, a sounding board, a conduit for them to be able to gain, the coordination of their own voice by themselves, so that you want them to independently be able to coordinate their voice freely and easily and effectively and efficiently to use it for any need they have. But yeah, it's all patient to patient. I mean, if you're working with someone, older and you're working with symptoms of atrophy in the aging voice, that takes a different protocol than someone who, someone with a motor speech disorder. You would approach that differently, something like a dysarthria or spasmodic dysphonia, neurologic disorder, or paradoxical vocal fold motion or vocal cord dysfunction, which is less to do with voice production and more to do with respiratory training. So, it really is very client dependent, but no two same diagnoses present the same because no two people are the same. So even if you feel like you're like, oh, nodules, I know what to do with these, it's going to be different for every single person you work with. And then there's the whole aspect of working with voices who do not present with a disorder. And as speech language pathologists who specialize in voice, we can also work with gender affirming voice training. And it is an area of voice that I am extremely passionate about. I love doing the work. It's taught me so much. I still learn from every single one of my clients. It's a beautiful, beautiful gift to be able to engage in being someone on someone else's journey to finding themselves. Like, talk about vocal identity and how the voice is so much of who we are. Oh my gosh, it's a whole new level. And it's really a privilege and an honor to do that work. But that has nothing to do with voice disorder. So it's a very big gamut, even within the voice specialty of speech language pathology.
Let's move on to our signature questions. And now I'm actually going to kind of skip to the second one, only because you actually answered the first question, which was, how often do you think about your voice? Which you said every second of every day. So yes. What is some advice that you would like to give to an aspiring young performer?
I thought about this question, and I think my biggest piece of advice is to know that you deserve to have a good team of people with you on your journey. And if something doesn't feel right, or you don't feel like you're getting the support that you need from someone, it's nothing personal, but know that you can advocate for yourself. You can speak up. You can, there are many, many people who do many different types of specialties that make up a vocal care team. Explore all options. It's like if you wanted a psychotherapist and you had 4 different consultations, or a life coach, you'd pick the one that you vibed most with, the one that you felt most heard by or from, and you'd go with that person. It's the same with the vocal care team, which of course can be comprised of many members and many different people. Surround yourself with people that you feel hear you and that you really feel like you can grow with.
So Jenna, what is something new about the voice that you've learned this week or recently?
It's not really new. I just have gained a much deeper understanding and appreciation for the impact that emotion and mental health and daily stressors and everything really, really has on the voice. And that by not acknowledging those aspects of oneself, you really cannot move forward in a lot of ways of your voice work. And that if you're working with a vocalist, and tools that you're trying or vocalises that you're doing don't work, it's probably something deeper. It most likely is something emotional. I think we all know this, but I think we underestimate the connection, the really deep connection that our emotions have to our voice.
What are you currently learning?
How to deal with that. Personally, Christine, I am on a whole other part of my journey. I am discovering this myself. I'm learning. Maybe you need additional team members that you didn't think that you needed to help you with your voice, right? Like a laryngeal therapist, or different types of therapy and counseling modalities, or body work, or yoga, or meditation, or talk therapy. Those professionals can all be very, very important members of your vocal care team, because we cannot separate that from the voice.
Perfectly said right during our mental health series on the podcast. So that's perfectly said. So what do you wish, Jenna, that you would have learned sooner?
I wish I had learned to advocate for myself. I wish I had learned to acknowledge that my own voice is just as important as all of the voices that I cherish working with and helping. My voice is deserving of that too, although it has not been the most perfect and well-behaved voice out there. It still needs TLC, and it's really important to find that balance, especially as a voice professional, to take time for your own voice, to still have your own vocal care team, to still tune into what you need, scheduling breaks into your day, work-life balance, sure. But as a voice user and a voice professional, finding vocal care time for yourself. I wish I had, it's something that we know, but really, do we actually do it? But it's just beyond important, and it's the greatest gifts we can give ourselves, so that we can then do the work for our patients and clients and students even better.
Oh, awesome, Jenna. If the listeners want to learn more about you or get in touch with you, what is the best way to do that?
Currently, the best way to do that would be through email. And my email address is jenna.battipaglia, BATTIPAGLIA @gmail.com. So just send me an email. I'd love to chat, answer any questions, and always happy to connect with more people in our wonderful voice world.
Amazing. Thank you so much for joining us on the podcast and talking to us about all things speech language pathology.
Yeah. Thank you so much for having me. It's really been a pleasure.
Thank you all for listening. If you enjoy this podcast, please tell your colleagues, students, and friends to subscribe, rate, and write us a review.
You can find us on Instagram or Facebook. And feel free to check out my website at www.thevisceralvoice.com for information on programs and upcoming events. I hope you join us next time for another wonderful conversation on
The Visceral Voice.